And right now, we want to switch gears and begin to talk about health matters, specifically concern over COVID-19 and the stigma around it, particularly the words that you should not be using, the words that you should not say. Here with me on the show, I have Dr. Yubreen Mora, who's a physician and a health advocate. Karibu sana to the show.
Thank you, Joyce.
It's good to have you here.
Thank you for having me.
Now, in fighting COVID-19, there are certain words, I guess, certain language, and actions that could actually tend to have a very negative effect on the larger population of people, and even just fuel some very negative attitudes around. And I think there's been many cases about it. We've seen discussions here, when, for example, our deputy Kilifi governor, got in trouble, and a lot of people were saying, no, that punishment is too harsh because it's going to create stigma for anybody else who, is already infected with COVID. They'll be too scared to come out. And so just to kind of update you guys on where we are at currently with COVID, there are now 270 cases here in Kenya. 270 cases in Kenya. I believe we stand at about 14 deaths as well. And so that's kind of where we are at. 67 people have recovered in total, but there are still 189 active cases. Okay. And the total tests conducted so far seems to be 13,239, I believe. So those are the current numbers that are standing here in Kenya. And so we want to talk about the do's and the don'ts. And perhaps we can begin with a do, which would be, let's talk about it. Like, let's acknowledge that this thing is here, because partly it almost seems like some portions of our population are just not taking this thing very seriously.
I think, Joyce, even before maybe we address the do's and the don'ts, let's just address what is the stigma around COVID. Because, we've talked about stigma in the context of HIV for the longest time. In the context of COVID, it's something similar, but what we get out of it is the negative association of the disease, which actually we have to acknowledge that someone doesn't choose the disease.
Right.
So if someone doesn't choose the disease, what is the trickle-down effect if we stigmatize someone against it? What that will do is it will hinder our efforts to try and combat and halt the transmission of the disease. So this negative association is what we need to address. And what you're addressing today about the talk and what we say is that words are powerful.
Yeah.
The other measures we can put into place to take care of stigma, but one of them is the words we choose.
Yeah.
And as you're addressing the do's and the don'ts and the words that we shouldn't say, one of them is referring to patients as COVID cases of victims. Because when you do that, you label. It's like you say Dr. Mora, the COVID. Get what I mean? So you're labeling and giving it a negative association with the disease. A lot of people who are getting this disease are not choosing to get the disease.
Sure.
And I don't think there's any human who will walk to it, yes, and say, COVID, come to me, or you've chosen to do that. Or anyone would intentionally say, I want to sit next to you to infect you, Joyce. So I think that's where we should start from. And I think the Ministry of Health is really trying to sensitize the public about stigma, but I think we need to do more. And as earlier on, I think in the show, someone was saying that we need our leaders to come out. And I think part of it would be us acknowledging that the disease is here and stop labeling this disease as the Wuhan virus, the Chinese virus, and some of those things.
Right, and we're seeing how that already, is creating such negativity, ethnic negativity, racism. We've been seeing all these cases, even from international news, simply because of this stigma. People are now beginning to turn against each other. And as much as, we are all Kenyans here, there's different ways. We don't want that to trickle down and start saying it's certain communities or certain areas of our country that are now, bringing, coronavirus, because that's not the case.
One of my patients told me the other day that, people in the village they're not even talking to them on phone. They're saying that you're the people with the people from the cities are the people who are bringing the virus. And already that is addressing stigma. It means in the village, people will not put in the necessary measures to mitigate the spread.
Right.
And as we are aware, the virus is already in the counties and in the villages. So I think addressing stigma, and I like that you're having this discussion, is a very important aspect of combating this illness. And I think even now I think when we talk about stigma, it's even how do we communicate?
Right.
How do we pass the message across? Like now in the people from the fourth estate, how do you pass the message? And I think I've had this a lot of times that, you know, there are 270 new cases. There's this patient someone who's suspected they're saying someone who is infecting other people. Those are very common words that are being used and thrown around. But you see, if you say that, what is the effect on the person? Okay. And it's not even the person themselves. You have social stigma, you have self-stigma, and you have the label of avoidance, where you see someone and if you're wearing a mask, someone thinks you have it, so they stay away from you. So what that happens is people will not put the measures necessary to actually combat this. And I think earlier on you're saying, what are these things we shouldn't be saying? Yeah. So we shouldn't be saying things like the Wuhan virus, the Chinese virus. Yeah. Instead, we should actually just say, the reason why this virus is called COVID-19, I think people are not understanding. Someone was joking, COVID-10, COVID-20.
Oh, no.
It's because the first letter core is for coronavirus.
Yes.
And then the corona, and then V is for virus, and 19 is because it happened on the year 2019. Okay. So it's essentially not because the C stands for any region of the world or any other individual. It's just for nomenclature purposes to also combat stigma.
Okay.
Yeah.
Okay. Well, we're going to touch on a lot of the do's after we come back from the break, but maybe we can just tease at least the don'ts rather after we come back from the break. But maybe we can touch on some of the other do's, which would be we should be talking about how the coronavirus is, do you say contracted? How one sort of gets coronavirus. Yes. That's something very important for us to be doing so that we're well informed and that we're not operating and moving around in ignorance. As you're saying, you know, people from, you know, our rural areas thinking that it's just the people in the city who have it. Very important for us to be having those conversations, but to do it from an informed view.
Exactly. So the transmission, as you said, it's very important for people to understand the mode of transmission, and that is part of ways to mitigate stigma by ensuring that we give correct information, correct, constant information from reliable sources. There's a 719 site from the Ministry of Health that people can read through. But again, how is the virus transmitted? The virus is transmitted through respiratory droplets. And those droplets can be in any site, from your nose, your eyes, your mouth. So you're looking at anything from saliva to all those. And even as we are talking now, I like the fact that we have enough distance from each other, but even that the droplets, the body droplets, the respiratory in origin, moving from one person to the next, then that's how someone can get the virus. That's why we are saying wash your hands, because if you touch a surface that has the droplets, then you get the virus.
So is it any droplets? Like, say for example, if someone sweats, you know, guys, is that a way to transfer the virus?
No. We said respiratory. So the origin of the droplets should be coming from your respiratory system. And what is the respiratory system? This is the lungs, the airway, the trachea, the windpipe, as we call it in layman's term, right from the nose. So anything along that lining, any lining all the way up to the lungs, to the site where the air goes in and it is absorbed, that is the respiratory system. Okay. And that's why we are calling them respiratory droplets.
All right. Yes. Well, we're going to take a break at this point, but when we come back, we'll still be here with Dr. Yubreen Mora talking about the stigma around coronavirus and how we can address that, okay? And if you have any questions as well for her, you can send them into 22999, and we'll be touching on those after this. Hey everybody, welcome back to Full Circle with Joyce. Here with Dr. Yubreen Mora, who's a physician and a health advocate, and we're talking about the stigma around COVID-19 and what you should and should not say. As we've been seeing on the news, there's been a lot of different cases of discrimination, really, against people suspected of having been infected with COVID-19 or even internationally, there's been a lot of cases about even racism coming out of this, and this is because of the stigma associated with this illness. And so we've been talking a bit about the do's and the don'ts, and I see you guys are sending in some of your questions. Someone here saying, there's a lot of stigma in the country against people with COVID. Can this make the pandemic spread more because of that? Can we fully stop it? And I think you were saying it actually could spread the disease, because then we're not going to hospital.
Yeah, or we won't observe the protective measures, because if we do, people will say we have COVID. Yeah.
During the break, we were talking about social media, and you were just saying how you're finding that social media is not exactly helping the situation. As in typical Kenyan fashion, maybe I should say, we make memes about everything, right? And I think there's been a lot of jokes about that as well. Hopefully now people are beginning to be like, hey, this thing is serious. You know, by the time your kids are home for a month and a half, you've had a pay cut, your business is not doing well. Hopefully now it's really beginning to sink in. But maybe from your perspective, just talk to us about the effects you're seeing from social media.
Social media is a blessing and a curse, as I call it. And I think with regards to stigma and trying to mitigate any form of propagation of stigma, social media is not really helping. What we are seeing is if someone gets the disease, or an area has some few people have the disease, people are making, as you said, they're making jokes out of it. And you see what that does ultimately is we never really appreciate the psychological impact of some of these things, because then people will hide, or they will not volunteer information. There was a case, I think, about 2 weeks ago when one patient who could have had COVID went to a health facility, and when they got there, and because of the stigma around the place they had traveled to, they did not volunteer information. And what happens, the effect after that is that the health workers who saw this patient, the cleaner who even allowed this patient to pass where they were cleaning, the security officer who was manning the triage before the patient get in, all those guys were exposed and they had to go into quarantine. So I think if we are not able to say that, as you're saying, what is the use of social media? Is it helping or is it propagating hate and discrimination and even xenophobia in some cases?
Sure.
You've seen some jokes about Italians or Chinese or some people from different sides of the country about the COVID. And I think it's nice that this conversation should actually come to our dining tables, into our living room, so that people actually appreciate the words you say are very powerful, and you have to be very careful about how you say it. And maybe it's time, I think there's a time the minister was saying they were monitoring what is shared on social media about the virus, so that we're not spreading lies or stigma. And I think it's something that really needs to be looked at, especially for the young generation that is very techno-savvy.
Right.
Yeah.
There's a question about the ones who do recover and then go back to their families. As you're saying, I think the stigma is there as well. I think at some point it was almost like a heroic thing, like, yeah, I recovered from COVID. But then now I think there's a lot of suspicion around it as well. And in fact, someone here is asking, hey, Joyce, my question is, or rather, I'm curious to know, and they say these people who are said to have recovered from this virus, when they go home, are they able to bond with their families, or are they isolating themselves? That's Carol from Juja.
Even from Carol's tone, you can tell. She's saying these people, you know. Maybe that's where we need to start from.
Yeah.
Like these people. It's like they're just a clan of people who maybe God is not looking at. God has just left them and abandoned them. And I think maybe that's what we also need to change. Remember, but I understand. Sometimes I actually say that the stigma around it, we just need to sensitize, because we need to understand that this is a new virus. We have very little information about it, if we have, and we're still learning about it. So fear is something that we expect. But the amount of fear then determines whether we move from just fear to stigma. So what we know is that patients would have COVID and then they would recover. What we don't know is, we don't have enough data whether they can get reinfected again, and what duration would they stay without getting reinfected. But here's the thing: when they're treated and they're told that they're cured, there's some tests that are run, and after some time, if they're fine, they integrate back into their normal social setup.
All right.
Yeah.
the government has been talking about mass testing. Of course, we're seeing a lot of the countries in the West, they've adopted, I think, that as part of their strategy to be able to sort of help flatten the curve. And we're seeing that now, coming into play here in Kenya. But there seems to be some concerns around that as well. Evans Abogi from Eldoret says, does turning up in large numbers to hospitals for mass testing pose a serious threat to infection that could dissuade people from getting tested like it did in South Africa?
We shouldn't turn up to hospitals in large numbers. Remember, one of the measures we're putting into place is social distancing. So that has to be observed. Even when we run the mass testing, it has to be in the context of people, a particular number of people at a particular time interval at a particular hospital, so that we are not all showing up in a hospital in numbers. Then we'll still be risking the same measures we're trying to mitigate about contact, and we've said that respiratory droplets is a big way of transmitting this virus.
Okay.
Yeah.
Another here is asking, should I worry about COVID-19 if I work in a place where we have, they're calling it quarantines around?
I think what they mean is the people who've been...
So maybe it's a hotel or some sort of facility where there are people who are being quarantined and they're staying there. So they're asking, should I worry about it? What risk do I stand and how can I protect myself?
Same measures. Wear your mask. Wash your hands at every point before touching the mask. And I've noticed, the other thing, Joyce, I actually have to highlight is people are really, the fear is driving people not to appreciate that we are busy saying wear your mask correctly. Please wear your mask and wear it correctly. There's a very thin line between that mask being useful and that mask being a disaster.
Absolutely.
Yeah. So just make sure you observe the right measures, respiratory etiquette, you're sneezing, you have to cover up, you wash your hands, you ensure that you avoid touching surfaces. You have to do your job if you have to do your job, but you do it observing the measures that have been put into place. And avoid coming into contact, which means touching the people, or even if you have to clean up let's say in a hotel or something where someone is quarantined, when those dishes have to be washed, you have to make sure you're protected, you wash them correctly. And I think these facilities need to make sure if the risk of respiratory droplets or aerosol production is high, aerosol production meaning coughing or anything that will make someone produce respiratory droplets, then they have to get shields to make sure these things are not splashing on them and all that. So it's not just the individual measures, it's also the institutional measures to protect their people.
Absolutely.
Yeah.
And still touching on, and it's actually really sad too, because sometimes you walk around certain supermarkets and I mean they have shields and like proper masks and you're just like, wow, our medical professionals, you wonder what they're using. But anywho, still on the topic of shielding ourselves or guarding ourselves and taking good care of ourselves, you've mentioned masks and how now that it's a government directive for us to be wearing masks, in a private vehicle, in a public vehicle, when you're outside, wherever, and you're saying a lot of people aren't wearing masks, and we're seeing a lot of people wanatembea nazo lakini ziko huku chini.
I think you need to do a particular run when you're doing your tips and all that, for people to know how to wear those masks, because there's a very thin line. The masks were put there to try and contribute to the other measures. And besides that, they must try to prevent stigma. You'll be surprised. Because remember, earlier on we were saying only people were infected and health workers. So anyone with a mask, people are just looking at them funny, like what's going on? But now everyone is supposed to wear the mask. It's supposed to also help with stigma. But please, let's wear those masks correctly. And also let's make sure that we don't use them. I was so saddened. I hope the story is not true, that Kenyans are just being conniving and going and washing those masks and reselling them back to the market. That is terrible. And I feel like a lot of us, me included, we are very selfish people. We don't think about, why you wear the mask? Actually, it's not for you. It is for me next to you. Because when you're talking and all that, you're trying to keep the droplets to yourself.
And we need to think about it that way. This is about protecting each other.
Yes.
Guys, I need you to be safe so that I can be safe. Right? That's where we need to be. So this whole like wacha nijipange vibes is not helping us.
It's not about you. And for the first time in history, and I think even looking from a very religious point of view, it's where you're seeing there's someone else who gave up themselves for you. It is your time now to offer yourself for someone else.
Sure,
you know?
sure, absolutely.
Yeah.
Let me see. There's some more questions here. Someone is saying, or hey Joyce, I'm Vincent from Kayole, a Form 4 student, and this is a great question. He'd like to know how the eyes are connected to the respiratory system, because we're hearing, this thing can get through your the virus can get into you through your eyes, nose, and mouth.
Okay, so your eyes, nose, and mouth are lined by a very thin skin. We call it mucosa. It's very thin skin. It's skin, but it's very thin. So because of the thinness of that lining, the virus does easily gain entry into your body.
Okay.
Eventually, it will go to your respiratory system. Whether it got into the mucosa of your eyes, the mucosa of your nose, or of your mouth, it will eventually end up there. And that's the connection. So we're just blocking any possible easy access for the virus.
What about our ears?
Our ears, the thin layer is quite inside, but we still say avoid touching your face, including your ears too, And if you have to, because sometimes you're itching, Joyce, wash your hands.
You know when you tell us don't scratch it, that's when now the nose itches. Like, I've been struggling. I always have an itch, and then I'm like...
What you do is you just wash your hands each.
Yeah.
Let's say you're itching you can't rub your eyes for sure unless you wash your face.
Yeah.
Then itch the place and then wash your hands again.
It's always my nose, right when I'm talking to you. And it's always on this show, always when I'm on air, when I know I can't go wash my hands just yet. But anyway, so if you guys see me making funny faces now, you know why.
You're trying to scratch.
I'm trying to scratch, but I can't. But let's talk about some more don'ts here. I guess even just... You mentioned earlier when we say cases, like that is also stigmatic. What would be the right terminology for us to use?
You'd rather just say infected patients or infected individuals, COVID-infected individuals. They didn't go and choose
So we don't make them a thing.
Yes,
they're still human beings.
Yes, they are not the harborers of the virus.
Yeah.
They are not there to serve, to move this something we are perceiving as evil and we are very scared about. They're not there to propagate it. They are also victims. Yeah. So we cannot even not use the word victim, because then you're trying to label it on someone. So the words that we are supposed to use instead of saying cases or victims is people infected with.
Yeah.
We can't even say suspected cases. You're saying people who may be having the virus. Yeah. Because you just don't want this virus to be owned or to be associated negatively to a particular group of people or individuals.
Sure. Ben is asking, what is the meaning of the word stigma? I guess maybe many people are struggling to say, but it is the reality, right? This is the reality of what we're facing. And now when we're saying we're being careful with our language, what exactly is the stigma? Maybe you can just repeat that.
Stigma in health just refers to a negative association of a particular illness to a particular group of people. So, and this ultimately results into difficult social interaction or even difficult detrimental psychological effects on these people. Case in reference that is a very good example is how we used to stigmatize people against HIV.
Right.
We used to associate it with sexual promiscuity, and so we just associated that these people are sinful and all that. And all that. It's the same way now you're seeing with the COVID. We're having people thinking that someone who has contracted the virus, this is how people are thinking out there. This disease is for the rich, and these people have been exploiting us. You get what I mean? And then they say the other thing is these people are reckless. They're just moving around the city. They've been told not to. They're even risking our lives. So you're having this very third eye, you're looking at someone in a strange way because they contracted the virus. And this virus, we said, I could actually walk into the studio, touch the surface, not wash my hands, touch my nose or my mouth, and I got it. Did I wrong someone? Did I do some sin that I deserved to get the virus? So I think that's where we come from. We need to stop the stigma and look at these individuals. And I think even the way someone was asking me the other day, Joyce, like, so do you know how we pick up when we contact trace? Like, I came into contact with Joyce, so someone will come to your house and pick you, or with your husband, you came into contact with Mora.
Yeah.
So the way these people are picked up is very dehumanizing, because you find them being roughed up, you know. So I know the scare about, I mean, the fear, I say the fear is expected because it's an unknown virus, but how we are handling picking these patients up with the people who are contact tracing should also be adjusted to avoid stigmatizing these people, because the neighbors come out and then they're staring at the person who's roughed up and picked up.
And
some
it's
of them are dragged into the
embarrassing,
ambulances, their children are crying. It has to be
Yeah.
dignified.
Yeah.
And at all times, we say, even in healthcare, we have to have a very human rights approach and a dignified approach to patients, whether suspected
Yeah.
or maybe having the virus. So,
Okay.
and we said we are not
We're
using
not
the word
going to use
suspected.
suspected.
Yes, maybe
Absolutely.
having
They're not
the virus.
criminals.
Yes.
Suspected is for when someone has committed a crime.
Yeah.
Right. All right. Well, thank you so much, Dr. Mora, for coming on to the show today.
Thank
And
you.
I think really the word that remains with me is the words dignified, and just to remember that these guys they're human beings just like we are. And this is, yani hakuna mtu anataka COVID-19, right? No one would wish this on themselves or their family members, their children. And so let's remember that we literally need each other. We need to take care of one another so that that's how we flatten this curve.
And this is a social responsibility.
Absolutely.
And solidarity is what we need.
Thank you very much for your time.
Thank you very
We
much.
appreciate you coming
Thank
through.
you.
And thank you for your questions. There's been a lot of them for Dr. Mora here, and we've tried to get through as many of them as we can. But for now, we do need to take a break as we get ready for the final segment of our show today. We're going to switch it up and talk about how you can have some fun activities as you stay at home with your kids. Stay tuned. This is Full Circle with Joyce.